Well, arthritis can cause a lot of discomfort, and before we close out May, we want to highlight Arthritis Awareness Month. Shay Rogers is the clinic director at Baton Rouge Physical Therapy. He's here to give us some tips to help ease some of that pain. Thank you so much for coming in this morning for us, Shay.
Absolutely, Reggie. Thanks for having me on.
So first, give us just a little bit of some of the impact that arthritis has on many people.
Absolutely. So arthritis is a very pervasive issue with most of our population. Up to 50% of all adults will develop some sort of arthritis in at least one knee within their lifetime. So arthritis can affect everyone in the ways of activities of daily living. It can impact their quality of life with pain and range of motion limitations, and it can really be a bother for some.
And when it comes to arthritis, how many different types of arthritis? Because I know there's rheumatoid arthritis and then there's osteoarthritis, right? Is one more painful than the other?
Certainly. So rheumatoid arthritis is very different than osteoarthritis. Rheumatoid arthritis is an autoimmune disorder where basically your body's own immune system attacks the joints, and that can kind of come in waves. Typically there's more of a genetic predisposition for rheumatoid arthritis. But osteoarthritis is typically more just a wearing down of the joints. And as a physical therapist, a lot of our patients come in with that. It is part of a natural aging process.
And I know we're going to show some exercises about, try to have to avoid, I guess some of that discomfort. But is it typically in the knees, or can it be just, I guess, in the ankle or in the leg, or where?
Arthritis can be really in any joint in your body. It's basically a wearing down of the cartilage that are on the ends of the long bones. And so the more you use a joint, typically, the more chance of an arthritic condition you may develop.
And what is it how do you treat arthritis?
Right, so as a physical therapist, I can't change people's arthritis.
Okay.
But what I do, I really work on the joint's mobility and range of motion to restore the normal mechanics of the joint, as well as exercises that we perform to strengthen the musculature around the joint. And that is going to help drastically improve the joint's overall mobility, the strength around the muscle, and then that offloads the joint, leading to decreases in pain and improved function.
And speaking of that exercise and mobility, we have these two chairs here, and she's going to show us, I guess, a couple of what is it that we need to do if someone who's at home and you said a flat chair, make sure it's not a rolling chair.
That's correct. You don't want to do any of these in a rolling chair. Some of these are going to be a little bit more dynamic, and so you want something sturdy to hold on to. But these three exercises, they are going to be very easy for most people to do.
Okay.
They are going to at least get your body moving. If you've never exercised before, these are going to be great options for you.
Okay.
So we'll just have a seat. The first exercise is just going to simply be what we call a long arc quad.
Okay.
Basically, it's going to be a knee extension. So you're going to slowly straighten your legs, squeeze the quadricep muscle, hold that position for about 5 to 10 seconds, and then slowly lower. So as you're doing that, Reggie, basically what this is doing, it's helping to strengthen the quadriceps. Yeah. And then it's also helping to improve your knee extension, or the straightness of your knee.
Okay.
That can be a common issue with knee arthritis, is a lack of extension. The second one, we're going to stand behind the chair. You're going to want to hold on to it if you have balance issues.
Okay.
Slowly take your heel and raise it up towards your buttock. This is called a hamstring curl. And then slowly lower down. Just do a set of 10.
Okay.
And so just be careful. You may get a little cramp in the hamstring with this if you're not used to taking that knee through that range of motion. But it's going to feel a little pull in the hamstring, and this is also working what we call knee flexion, or the bending of the knee, and helping to strengthen the hamstring.
And the last one is, I guess you call like a squat. I'm going to let him do that because these old knees could not handle this one.
So the squat, basically, it's a squat with a bottom tap. So find a solid chair, and then you're going to slowly bend your knees, sit your bottom back, hands out, tap the chair, and then come back up. You don't want to sit all the way down because then that takes away the tension in the musculature, but this is an excellent exercise to do. It's probably the best out of the three if you can complete it pain-free.
And you said do those three exercises. Should they do them daily? You said, I guess, 3 sets of 10, 4 sets of 10, or what?
Yeah, absolutely. So the first two can easily be done daily. You can do them almost every hour if you so choose. And then the second one, or the third one, the squats, probably about 3 sets of 10 every single day.
And changing your diet and all of that can also help, right?
Certainly. So any type of weight loss will contribute to decreased arthritis pain, certainly, because it's less pain, less weight on the joints.
So if someone wants to reach out to you all and I guess get physical therapy and learn more, what is your all's information?
Absolutely. So they can contact us at Baton Rouge Physical Therapy-Lake.com or BRPT-Lake.com. They can also call any of our locations scattered throughout the Baton Rouge area.